Right now we're joined by regenerative medicine researcher from the University of Florida. Please welcome Dr. Mark Moore, PhD. Hi Mark, welcome to the show. So you're the one who gets to conduct the research on the stem cells that are associated with placental tissue. Mark, tell me exactly, what do you do?
I'm very lucky. I get to study the placental tissues, which is a one-of-a-kind tissue. It comes from healthy births, and this tissue can be used in a lot of different ways to help people in cell therapies and people who have cancers and all sorts of diseases. And so I look at the growth factors and the material, the extracellular matrix of the placenta, and how it can be used in medicine.
Well, now, what has the research told you about regenerating the joints in the knees, the hips, and the shoulders?
So there have been a lot of studies about the placental tissues and the growth factors within them. These are the same kind of growth factors that have been shown to regenerate tendons and joint tissue. And so the studies have shown that they have the capability to regenerate tissue, reduce pain and inflammation within the joints of hips and of elbows, etc.
Mark, can you tell us what's on the horizon for stem cell research in the near future?
So there is so much that's on the horizon. This is a field that has a lot of potential growth, the potential to cure many kinds of diseases. So for example, there's new technology to 3D print cells onto surfaces to regenerate and create organs, patient-specific organs that can be used to regenerate tissues. These cells can be used, and these tissues can be used for cancer therapies as well, and there's many studies currently ongoing to analyze those kinds of therapies.
Well, that's pretty cool. Now, how long do you feel that these advances are from reality here in the United States?
Well, some of them are currently being realized right now in the present. Some are 4 or 5 years out, but there's many different advances coming out. And so, but currently some of them are already being realized. So it's something of the present, actually.
So one of the biggest questions that our viewers have, is this FDA regulated?
Well, the FDA does manage the process, and there are a lot of guidelines that have to be enforced and adhered to. These tissues are tested for microbiologically, and they're tested serologically to determine if they're safe. The patient donors are also interviewed, and their lifestyle is assessed.
You know, Mark, so many people are skeptical about the word stem cells because of the cloning and the Planned Parenthood issues that happened in the 1980s. How do you address this issue?
Well, these tissues have nothing to do with cloning or Planned Parenthood. These tissues are all from healthy donors. They're from healthy births, and this tissue is normally waste tissue. It's normally thrown away. But the mothers donate the tissue in order to help society and as a potential to make someone else's life better. And so these tissues are from cesarean section births, and they're all clean and sterile and healthy tissues.
So tell us, how do you actually obtain the amniotic tissue?
So they have a team working with the doctors and nurses within the operating room, and they collect the tissue immediately after birth of the healthy baby, and they're immediately processed by a team, again, working with the doctors and nurses.
So you're telling me that the screening process is that thorough?
Yes, absolutely. These tissues are assessed. They adhere to all FDA regulations and guidelines. They're incredibly safe, and they're harvested in a sterile, in nearly sterile environment. And so yes, they're very safe.
Now, we talked about the donation process. So once a woman has a C-section, exactly what happens?
Yeah, so once they have a C-section, again, the nurses and doctors are, after they deliver the healthy baby, a team of technicians is standing right beside in order to collect the tissue. And so the tissue is then processed, and it's assessed to make sure that it's a healthy tissue and good to be used to make the amniotic tissue-based products.
So let's get into some details. You have the placenta in your processing lab. Can you explain the process of getting it to the point of being able to use in patients?
So the tissue is first assessed to make sure that microbiologically and serologically the tissue is safe and healthy. It's a good donation that we've received, no reason to reject the tissue. And then the tissue goes through some sort of proprietary processing. But in general, the goal of these processing treatments is to maintain the natural characteristics of the tissue. You don't want to recreate Mother Nature. This tissue is an amazing tissue with capabilities of curing disease. And so the goal of these processing techniques is always to preserve its natural molecular structure.
So how much testing is done to make sure that it's safe?
These tissues have been used for over 100 years. One of the first uses of them was in Johns Hopkins University in 1910. They were used to cure burns, and they have had decades-old research to show that they're safe, effective for healing all sorts of tissues. And so now they've been used in ocular uses. They've been shown to stimulate nerve cell growth. So they have a lot more potential that hasn't been tapped yet.
Mark, can you share with me why it's important to keep the tissue at minus 80 degrees?
Yeah, so the cold temperature is very important. The faster that these tissues are put into the negative 80 extreme cold, the more that the molecules are preserved. Again, the goal here is to try to keep the natural molecular structure of the tissue and the growth factors. And so putting them at negative 80 preserves those molecular structures. Heat degrades molecules. And so putting them at negative 80 keeps their structure and keeps the tissues in its natural state so it can heal the most.
You know, Mark, this is one of the most important things I've heard, that there have been over 300,000 treatments and not one reported side effect. Is that true, and can you tell me why?
Yeah, so the number is very large. There are a lot of treatments that have gone through and they have had no adverse effects. And that's not really surprising to me because these tissues, I've seen them in the lab myself, they don't elicit any sort of immunological responses. And so they're really amazing tissues. There's nothing quite like them. Other tissues that comes from cadavers or artificially made biomaterials, they just lack the natural complexity of these tissues, which has this amazing regenerative ability.
So the FDA has guidelines. It's safe, it's ethical, and we've heard from so many patients how well this procedure works. Can you tell me what other applications is this tissue used for?
So this tissue is used for ocular regeneration of the eye. It's also used for healing diabetic foot ulcers. And there are many, many other uses that are currently being explored. Doctors have done many exploratory surgeries to show these are capable of healing tissues all throughout the body. And there are many clinical trials currently underway that can be seen at clinicaltrials.gov. So many, many specializations from orthopedic, cardiovascular, neurological, et cetera.
Well, Mark, I want to thank you so much for sharing your time today. I'm sure that you're very busy at the University of Florida doing the research, but is there anything else before I let you go that you would like to share with us?
So I know the story of one truck driver who had osteomyelitis of his toe. Basically, his bone was, his joint was severely degraded and he had an infection, and so it was about to lead to amputation of his toe. So he had an injection of a flowable amniotic membrane, which saved his toe.